The Global Fund has committed almost $1 billion to AIDS, tuberculosis and malaria programs in Tanzania. But one of the biggest challenges has always been the last mile. How do you get the drugs and the commodities to the remote villages in Tanzania? And that requires more than money. That requires particular expertise. I myself have worked as a doctor in the remote areas of Tanzania, so I could see that there are Coca-Cola bottles everywhere, and it was always intriguing. Why can Coca-Cola do that and we cannot get the drugs to these places?
Initially, when I was told about Coca-Cola working with MSD, obviously, I have to be honest, you get a bit puzzled because we're dealing with medicines, they're dealing with beverages. But I think as more things and more discussion took place, we started to see some synergies on how we can work together.
As a corporate citizen, it is in our interest to ensure that the communities that we serve prosper alongside the business.
There is a need for MSD now to go from 500 distribution points to 5,000. So there is a need to look at logistically how can MSD fulfill that additional requirement.
Why is it that sometimes we have stock available of essential medicines and sometimes we're stocked out? And the real root cause for that was around the sort of proactive planning and management.
And if these skills are infused even in the public sector, they will enable them to provide more service cost effectively to the communities that require those services.
We need actually to care to see the whole of the supply chain, not just a segment of supply chain, which means we need to sit together, try to improve how we are planning.
The mind of the staff has been changed. The business as usual perception is no longer there.
The whole concept of public-private partnership has become a true concept for me in practice, not just as a theory.
Our genuine hope is that this project will be a spark for many others like it. As we've worked with the health community, we've come to learn that the sort of challenges faced in Tanzania are common to many countries.
Each of the partners has demonstrated exceptional commitment and vision in the development of this unique collaboration, drawing on the complementary skills and strengths of each to form a powerful whole. The Global Health Leadership Institute is excited about the opportunity to research the implementation process in order to form new evidence about what works for effective public-private partnerships.
This is a very exciting example of a collaboration where the public sector could learn from the private sector to improve its services. And I hope it has been as exciting for Coca-Cola as it has been for the Global Fund.